My name is Sylvia Black. Today I'm going to be informing my audience about the lifelong disease of diabetes in the U.S. The learning objectives today, we're going to talk about the types of diabetes, we're going to talk about the causes, and I'm also going to do a small little breakdown of how insulin affects the body with diabetes, and I'm going to talk about treatment options. Everyone living with diabetes should basically know all the causes that I listed. Imagine this, or picture this. It's a middle-aged African-American male laying in the hospital bed, drenched in sweat and discomfort. Drenched in sweat and discomfort. Nurses work around the clock trying to figure out the symptoms of their patient. The symptoms worsen: fatigue, frequent urination, and blurriness sets in. Blurry vision sets in. The doctors rush in with needles and medical equipment to try to calm the patient down. When the patient sees what's going on, he's confused and scared. Doctors gain control of the patient and treat the patient. The person that I'm talking about is my father. My father's been diagnosed with type 2 diabetes since 1987. That's my dad, Vernon A. Neely. According to the American Diabetes Association, 28.5 billion people in the U.S. have diabetes. That's 8.3% of the population. Now this is a slight breakdown of the insulin. When we eat, the food is broken down to the bloodstream as glucose. Our bodies need glucose for energy. As the level of glucose rises, the pancreas receives a signal to give off insulin. Insulin is produced by the pancreas. When there's not enough insulin, the cells cannot provide energy. Now we're going to discuss the different types of forms of diabetes. There's three types of forms of diabetes. You got type 1 diabetes, type 2, and gestational diabetes. Type 1 diabetes is basically the body does not produce no insulin. And when the body doesn't produce insulin, the body is short of insulin, it needs insulin. It's three types of injections that you can give the body so the body can have insulin. One is called a shot, one is called a pen, and one is called the pump. Those are the three methods to get insulin in the body for someone that has type 1 diabetes. Type 2 diabetes is the body produces only a small amount of insulin. So that has to be controlled with regular exercise and diet. Then you got gestational diabetes. That occurs when a woman is pregnant. Gestational diabetes is when the body doesn't make enough insulin for the mother and the baby. MedPlus says that 100 women in America, MedPlus says 100 women in the U.S., out of 100 women in the U.S., 3 of 8 of those have gestational diabetes. Now that we talked about the different types, we're going to go into the causes that can trigger diabetes. The first cause is going to be family history. When a parent has diabetes, it's more likely they can pass it on to their child. Senior investigator James W. Warren, MD, from the genetics department in Boston, states that Americans with type 1 diabetes at age 70, that's a 1% chance. People with type 2 diabetes have a 9 to 11% chance of getting diabetes. Then we're going to talk about adult obesity. The more you eat, the more the body wants insulin. And the more the body produces insulin, the pancreatic cells, they start to collapse. Medical News Today states that the national adult obesity rate is 27.5% in 2011, as to opposed to 26.9% in 2010. And the last cause for diabetes, we're going to talk about unhealthy eating habits. The more the person eats, the higher the risk is for diabetes. If you practice a healthy diet and exercise, this can reduce your risk of getting diabetes. Now we're going to talk about the treatments provided if someone's diagnosed with diabetes. Basically, you want to be steps ahead of knowing about diabetes if you're diagnosed with it. And how it can be treated: you want to check your blood sugar regularly at home. You want to monitor it and write it down. This can help the person monitor their blood levels and see if they're within the range of 70 to 140. If you don't take care of yourself properly, the whole body could be affected by diabetes. And yeah, it could be affected by diabetes. According to the Disease for Control Prevention, the leading cause of diabetes is from blindness, kidney failure, and heart disease, and amputation of the feet and legs. In conclusion, now that we've discussed the causes of, now that we've discussed the different types of diabetes, which is type 1, type 2, and gestational diabetes, and we discussed the different causes of diabetes, which is hereditary family history, unhealthy eating habits, and obesity. And diabetes can also stem, like I said before, from heart disease, stroke, and kidney failure. If someone's diagnosed, if they take into action an exercise plan, a healthy diet, and they have support, then basically it's a little easier for someone to cope with diabetes. Thank you.